and the answer for that is no. A child is not a little adult, and we should not treat them like so. All the medications, even the Tylenol, for whenever they have a fever, it should be recommended by a doctor.
Hi, I'm Tom Lathan, and welcome to another edition of Community Highlights Online, a look at the programs, services, and people of Sunnyside Community Hospital and Clinics. Dr. Ana Garcia of Sunnyside Pediatrics is one of two pediatricians in our hospital system. Dr. Garcia said that she and her partner, Dr. Ann Nealon, work with parents to care for their children.
So always a family should go to a doctor whenever they feel that the child is not feeling well, and they should go for advice if they have any kinds of concerns or problems. I really do not have any problem for them to be calling me and asking me any kinds of questions. For me, there is no dumb questions and there are no dumb answers either. They can have the least concern of how much do I need my child to wash their hair, if it's okay to wash it every day or not, to very, very, serious questions about my child is not breathing well, what should I do? And allergies, there's a lot of medications for allergies, and we should not be buying anything we find in the pharmacy for a child. The allergy medication should be recommended by the doctor, either pediatrician or family doctor, and it should be under adult supervision that we give it to them. Usually I like the Claritin or Clarinex, but that doesn't mean that we can just go to the pharmacy and buy the first Claritin or Clarinex that we see. There are special recommendations for children, and they should go to the office and just do an evaluation of the allergies of the child and just get to see if it's going to be a good and beneficial medication for them, just as any other medication.
How much exercise does your child need? Well, it depends on your child.
One child is going to tolerate less amount of exercise. Of course, they're going to get tired a lot quicker. But I would say that the minimal, I cannot tell you what time would be the best amount of time for a child to be doing this exercise. It all depends on the resistance that the child has. There are some athletic children that can tolerate hours and hours of just bare activity, and there are other children that are not going to be able to tolerate that. So each parent may know what kind of amount of exercise is good for their specific child. Now, a child should have a level of activity every day. This is important to keep that metabolism running, and that is important just to burn those calories they're ingesting. They're going to be extremely hungry, especially in the teenage years, and if we're not careful, then we can have an obesity problem.
When the weather's warmer and sunnier, sunscreen is as important for your child as it is for mom and dad.
With children is the same way. I would suggest that parents should just put, let's say, a 15 sunscreen on a child is going to give the same protection as a 25. It's going to give the same protection as the 50. The protection level is not going to increase by the numbers, but the length of stay in the skin, that's what's going to be different between these lotions. There are some lotions that are specifically for sports. Those are really, really good because they stick to the skin, and not, if you're sweating or going swimming or whatever, they're not going to be off as easily as a normal sunscreen would do. But
Dr. Garcia says the benefit of involvement in organized baseball, soccer, or some other sports activity is very good for both boys and girls.
Yes, I am. They are good for many things. They keep them active. They socialize with other children. They make friends, and most importantly, they get to do something that's outside of the house. They're not there just sitting, watching TV or playing video games. They are actually, enjoying a sport.
Dr. Garcia believes that all parents need to be better informed about when to go to the doctor's office and when to head straight for the emergency department. That's one of the subjects in the second part of this interview. Thanks for clicking in, and be sure and watch for more community highlights online. But always remember, nothing you read or hear online can substitute for a personal visit with your family doctor or your child's pediatrician.